We're back, and I want to thank Dr. Bell for joining us today. Appreciate you coming in.
Thank you for having me.
Sure.
It's a pleasure to be here.
And Dr. Bradley, thank you for sticking around for another segment.
Certainly, glad to.
We'll jump right in here and ask you about the importance of these regular checkups for these children, the low-income children in our state, and the free services we need to emphasize. As a practicing pediatrician, doing these checkups all the time, what are you looking for?
The well checkups are very valuable opportunities for us as pediatricians to sit down with the family while the child is not ill and there's no crisis moment, and to be able to look over the whole health of the whole child. And so we're looking in these well child checks for hundreds of different diseases, developmental problems, social, mental health problems. And so those opportunities are really important for us to be able to do just general screenings for anything that might be going on that could adversely affect the child's health.
In that window of time, how can you assess and find out so much critical information in that short amount of time?
That is a very good question. Even as a parent myself, I have gotten frustrated with the amount of time it takes me to go through my well child visits at times. And there's a lot of paperwork that we ask parents to fill out. But I think that the important thing is that that paperwork has lots of questions, and every single question tells us something that's very important about screening for a particular disease or a particular developmental delay. And so it is just so important for us to be able to do that. There are hundreds of questions that we ask in doing appropriate developmental screening. And each one of those things helps us identify a specific disease that the child might be at risk for. For example, we often use what's called a PEDS score form, and there are 10 questions on that particular tool. And that helps us screen for developmental delays of speech, of motor and fine motor development, of social development and autism, and also for other emotional or mental health problems.
What do you see the most in your practice? What kind of situations, conditions?
That really varies by age. In the under 3-year-old or so age group, we see a lot of developmental delay, so fine and gross motor delay, language delay, and that's really that valuable opportunity to start to see signs of autism. And so we can diagnose autism and again get them in for early treatment, early therapy. From the 3 to 8 year or approximately 8-year age range, we can start to see some learning delays. We start to see ADHD in that age group, and so those are very important things for us to detect in that age range. When you get above 8, we start to see some anxiety and depression, so we're very heavily screening for mental health disorders in that age group. And then as they move into those preteen years, we start to look for things like substance and alcohol abuse.
So thorough. Wow, yes. So thorough. Now, Dr. Bradley, those are very complete screenings, it sounds like. What if the pediatrician finds something, then what?
Yeah, so I think the nice thing about this program, TennCare Kids, is that when conditions are encountered, discovered, then the physician and the parent make a plan, and those treatments or further evaluations are covered. That may be done the same day. It may be a return visit, or it may be a referral. So a child has a vision problem, there may be a referral at that point to an eye provider. If there's a problem that turns up on the dental or oral examination, then a referral is made to a dentist. And there are times when that's the first time the child has ever seen the dentist. So there are good connections that are made.
Again, relationships are important, developing those relationships with the physicians. Why is it some parents aren't taking advantage of these free exams, this free care? They just don't know about it?
I think that's part of it. Medicine's come a long way in the past 20 years, and back when I was 12 years old, there wasn't a whole lot that was done at my well child check visit.
No.
But now there are so many things that we're screening for, and so many new medicines and therapies that we have, immunizations that we didn't give even 5-10 years ago. It's so important for us to be able to give those, and thinking prospectively, not just about childhood infectious illness, but now we have vaccines for things that can can prevent cancer in these children when they're 50. So it's very important that we're thinking about those things and getting those adolescents in.
Speaking of immunizations, a lot of talk about immunizations for the past several years in the news. How do you make a parent comfortable if they say, no, I've heard that can lead to other problems? How do you assure them, reassure them?
Yeah, immunizations are probably one of the most studied aspects of pediatric medicine that we have. All the immunizations that are routinely recommended on the AAP schedule have been through years and years of research to make sure that those vaccines are safe and effective at preventing the disease before they're put on the market. They're also well studied to make sure that the side effects of the vaccine are much less than what the problems of getting the actual disease would be.
Okay.
So those therapies are very well studied before they're put on the market.
Dr. Bradley, remind us again, for parents maybe just tuning in, how do parents get the screenings for the kids? If they don't know, where do I go, who do I call?
Yeah, so all the health plans in Tennessee that work with TennCare do as much as possible to eliminate the barriers. So the first call should be to your child's physician or healthcare professional. So that's where the exam is best delivered. If there's a need for assistance scheduling, then if you will call the number that's on the back of your card, your insurance card, you'll get assistance scheduling. If you need a primary care physician or need a reminder about who that is, same there. And oftentimes it can be a warm transfer from that call to the primary care physician's office. We also offer transportation. So if you find the transportation's a barrier, that same number will get you to our transportation services where you can arrange a ride to the doctor and a ride back.
So no reasons no excuses for not taking advantage of this. Thank you both very much. And we'll be back with more of Community Health Matters right after this.